The purpose of this meeting is to share information about encumbrances and expenditures, contracts that have been awarded, changing needs in the community, and projections of future need, and engage the public in a debate about how future Coronavirus Aid, Relief, and Economic Security Act grant money is spent. Lynn, can you please call the roll?
Yes, ma'am. Councilwoman Dunaway.
Present.
Councilwoman Days.
I'm here.
Councilwoman Gray.
Present.
Madam Chair, you have a quorum.
Thank you. The committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. So thank you all so much for being here this morning. I really appreciate seeing so many experts on the line here to talk to us about what is happening in the community and where we're spending money and future projections. I also want to take a moment to bring up an issue that has gained increasing momentum in the last week or so, and that is the issue of childcare and how we can't have serious conversations about reopening the economy without also talking about childcare and how to make sure that this already untenable system not only survives this pandemic, but we need to work as a society to ensure that we are supporting early childhood education and childcare moving forward. We are seeing already throughout the country in studies and reports that women are taking the biggest hit when it comes to taking care of children as spouses return to work, as parents return to work. And we can't set the careers and the futures of women back another decade or century while scrambling through to maintain a status quo system that already wasn't working. So we want to make sure that a portion of this conversation today is focused on childcare, but we also want to talk about the other very important issues that are affecting our community, including food insecurity, medical care, and access to continued medical care as we reopen the economy and move forward. We also expect a pretty robust discussion of the Small Business Relief Program, and we've seen some pretty significant expenses that we have many questions about that we'll get to toward the end of the meeting. I think I'm going to be handing it over at this point to someone on the, Shannon, I'm not sure if you're the one that's going to take over, but the first thing we really want to talk about today is the process for ensuring that we're taking diversity, inclusion, and equity into consideration as we decide how we are spending the CARES funds.
Good morning. Thank you. Thank you for having me today. As you all likely have heard, I have been reassigned and will be supporting Cindy Brinkley, who could not be here today, in her role. So that is my role here now, and I'm sure we'll be seeing more of each other. So thank you again for having me. We did prepare a presentation for you today. I sent that over to Chris. I'm not sure if he can share that. And I thought that we could hear from Spring Schmidt, who's on the line, also Michelle Ryan, who's on the line as well, and Deborah Patterson, another of our volunteers. I can speak a little bit to the small business program. We did not prepare part of our presentation on diversity, equity, and inclusion, although I will say that I think this group of folks who is working on this initiative realizes that diversity, equity, inclusion applies really to everything that we're doing. It's a part of all decisions that are made and part of the process. And I think as you hear Spring and Deborah Patterson talk about what's been going on, that will be evident that it's part of the process. We do anticipate in the next week or so formalizing more of what that looks like and making sure that as we really set the structure in place that we have a space for that, and it's an ongoing piece.
Great, thanks so much. Chris, are you having any presentation?
Sorry, hold on just a second. I'm trying to pull it up so that I can make it full screen. So give me just a second here.
Well, while he's doing that, I do want to, I guess, some issue that has come up when I'm looking at the county care structure. We got that last week, and so I had a chance to look at that. first of all, and I appreciate that, because I think I've asked Kelly before about some kind of organizational chart so we know who to call, who to talk to about each one of these. I need to have, under humanitarian, who's the committee that's doing the food, the shelter, the health, under the public health, who's doing all of those kinds of things. So I will know who to call in case there is an issue. I called Cindy on one of these, and of course Cindy transferred me to somebody else who could answer the question. I don't think we need to have an in-between person there. So if there is any way that you can indicate there who's in charge of what and their contact, that would be helpful for me. I'm not sure about the other committee members. In addition, as you speak about the diversity and inclusion, Shannon, I did notice on the chart that was presented last week that diversity and inclusion, it seems to be after the fact. It's at the bottom with legal and IT and all those. If diversity and inclusion is important, it needs to be at the top where we're looking at that. If it's a lens, we're looking at that first and foremost before we go to anything else. We're looking at what does this look like in terms of diversity, equity, and inclusion. So if it's possible to make those kinds of, or you could explain to me, you know, where, why it's there, and how we get to that being at the bottom of the list there, that would be helpful for me.
Thank you, Councilwoman Days. To your first point about organizational structure, I was brought in, last week and assigned here, and I think part of my role will be able to help bring some organization to this and make sure that we get information about how it's structured and how it's operating out to everyone so that everyone can see what's going on and see that clearly. So I look forward to being able to provide that, names of folks, and really being able to show the full picture. And I agree with you on diversity, equity, inclusion. I did look at the PowerPoint from last week, and I understand, it looks hierarchical and that it's across the bottom. But as I said before, and I stand by this, diversity, equity, inclusion is not just something that is an afterthought. It's part of, as you said, the lens that you use to make decisions and formulate the process and all of that. And I think that's, as we formalize it, that's where you'll see it. And that's how you'll see it running throughout everything that we're doing, as opposed to just an aside or an afterthought. So I appreciate your comments, and they're well taken.
Okay, and not sure where Deborah is on this in terms of looking at leaders in this. You want your leadership to reflect what you're trying to do. If diversity is truly what you're trying to do, then your leadership is going to reflect that. So I'm assuming the leader advisor is Cindy, and then that puts you, I guess, as the deputy. Shannon, is that correct?
I'm not sure, ma'am. I have not been given a title.
Okay, well, you're up there with Cindy, so you're helping her, so I'll give you one. But again,
Okay.
There's no diversity in that level either. So let's look at all of these things as we go through. And it's nice to talk about these, but we need to actually be about the business of doing it. Optics is what I'm looking at. The optics are not what we're saying. The optics are not there. So, okay, that's it for me for right now.
Thank you.
Tell me where you want me to go, Shannon.
Just a couple, and I do just want to reiterate the overarching mission of the CARES Act initiative, making strategic impact in the county through our direct public health, humanitarian, and economic investments for the most vulnerable and affected populations. And that's how hopefully this presentation and others will be organized for you. Here's our public health bucket, purpose to save lives, and we have Spring here to talk with us. She provided an update on the next slide.
So there are several pieces of the things that we've recommended. Certainly we have some of the significant costs in the health department for the contact tracing and case investigation, the amount of testing that we're doing, and the PPE that we're providing to the community partners and to the general public and to the long-term care facilities that have been our focus so far. But we also wanted to engage in how we could address some of the other needs for access to care in some of our highest need areas. And so we have, used our Recast model for 4 years now to directly engage our community members in the most important decisions about how we spend money. So we have we got with the Recast team leaders and talked about how that could be modified to include the broader array of county zip codes that have really been challenged and are challenged. So it's not based on the promise zone, it's based on the broader areas of the community that have seen high numbers of cases, that have just high amounts of need across the board. And they've put together a package so far of how they think they can do participatory budgeting with residents, where we meet with residents, they talk about the access to care, health services that they most want to see in their community. And then we structure the online application to organizations based on those needs that the residents identify. And Recast has done training on this, and so we have materials that we can already use. They've done a lot of advertising previously for people to be Recast delegates. And so they do have a good network for reaching into communities. And many of our previous delegates who have helped us choose services in the health department before will also help recruit people to participate in those discussions. So to identify what are the core areas and locations that we should draw services to, and what should those services look like. And then the applications will have to meet those needs. And then and it will be, around access to care, particularly for testing, some clinics, maybe additional health workers, but those have to be set by the residents themselves. And so then we will have a period where the applications are open, and then the residents will also help for the proposals and say which ones that they think actually meet what they asked for. And then have some community voting as well for the services that are chosen for some of the direct funding for services to take place in these areas. And then we are still working on the big supply chain. So there are probably a total of, I think we've ordered 2 million disposable masks that can be given out, and we are ordering up to 1 million cloth masks that are reusable for members of the community. So we've been focusing on long-term care facilities and other critical industries, members of the general public. How do we make sure that everybody who is out on public transportation or out trying to conduct their work and their business has access to a mask? And then a significant amount of money towards the test kits and lab services for both the health department, for some of the partner sites that may go through the community funding process, or some that don't go through the direct funding process. They just need a supply of test kits and PPE in order for them to maintain their operations. And we've been giving out PPE to some test sites, but as we get the tests in, we want to be able to provide them with test kits too. And then the home care kits, that was part of our appropriation that we asked for council for, and we're getting ready to do the request for proposal for that for people who have needs in isolation. And then also some of the support services that will be necessary for folks who are isolating, with quarantine as a positive case, or with their families and contacts, and some of the support services they may need. So it's a combination of community funding that's determined by residents in our highest need areas. And so all of the zip codes except for one are in North County, but there is one significant zip code in South County that is identified with some additional issues. It's in the Hancock-Lime area. And then that's direct funding, and then a lot of materials that we put out in order to help people, and then some of the infrastructure for the health department for all of the contact tracing and the case investigations and the additional pieces that we're doing to keep all of those folks working remotely. And so that's the plan that we've put together.
Can I please ask everyone, if you're not speaking, to mute your line? There is some feedback. And Spring, I have some follow-up questions. As you know, some folks from our office put together a list of some of the bigger expenses that we've seen come through. And there are hundreds of thousands of dollars in masks and supplies from a few companies. And we want to understand, how did you decide that you're going to use these companies? How are we determining the safety of the equipment that they're providing? Do we have enough? How much more do you anticipate spending? Because it looks from the list we have, over $1 million already, at least in masks. And there are questions about where they came from, how that was decided, and whether they're what we really need.
So I'm going to ask Michelle to speak to the mask piece a little bit. We've ordered those through the EOC process. So they have had, I think, they've been investigating companies around, really for a while, for the different types of masks that we've been providing and that we've been buying. And so there are like the disposable surgical masks, which are pretty good for the general public, but they're only for like a brief use. And so those are the least expensive thing that we've been ordering. We've been ordering them in large quantities so that we can give out a lot of them. And then we've been ordering the healthcare level PPE for long-term care facilities. And then we've also placed orders for the cloth masks. And so as we've been getting those in, those have been hard to get a supply chain on the market for, but they investigate as many companies as possible, trying to identify based on entirely on cost. Michelle, I don't know if there's anything that you want to add to that part.
Yeah, so whenever the EOC activates and we know that purchasing items is going to be a large part of what we're doing, we bring procurement out to the EOC so that at all times county's procurement policies are followed. We have a specialist here. He has a lot of knowledge about procurement, but certainly not the kind of knowledge that you can get from our own county procurement and Jen Keating's group. So Jen is really good about, we have 2 people in her office that we've trained in EOC processes. So those folks are able to come out to the EOC when we activate, and they do all of our procuring for us so that we make sure that we're following all of the guidelines. I know in this particular case, they were doing a lot of research on companies. They had actually flagged several that they did not want us to use because there was something that raised flags in their eyes, and that's good enough for us. In the beginning, they were looking at, I believe, 2 things: price and how fast we could get it so that we could get it into the hands of first responders and healthcare workers. Now that things have we've sort of settled into a nice pace, they're able to focus more on price. We're trying very hard. We always do during EOC activations. We try very hard to buy local and support our own citizens in their businesses. Does that help at all?
Yes, that helps somewhat. For me, Madam Chair, may I ask a question?
Please.
Any of the companies that your suppliers that you're utilizing now, or any of the minorities?
That's, yeah, I'm sorry, I have my logistics specialist in here. That whatever policies procurement has, those are the policies that they follow even in emergencies. My logistics specialist just told me that he knows for sure at least one of them is minority owned.
One, okay, all right.
That's the only one that
Local? You know they're local or not?
was that minority. Yes, local.
Out of town?
No,
Oh,
they
okay.
were. We try very hard during any activation to support local because those are the folks that are impacted, and we prefer to give our business to our neighbors.
That's helpful. I think that, and I like that. So yes, you've answered my question. Yes is the answer. Thank you.
Yeah.
And then I want to follow up on one other piece of this, and it is that there will be many more costs related to supplying masks for a population our size.
Yes.
So
Can you be a little bit more specific about what dollar amount many more looks like?
it will probably in total for all of these pieces be in the $5 million range.
Yeah, I would say over the last 2 months, we've spent just over $1 million. I would say if we're going to do this into the end of this year, which is what we're being told, then what are we're in? I'm sorry, I lose my days when we're activated. We're in May, so I would say we would need to be prepared to spend probably 3 to 4 million more.
So what is your plan for making sure that we are reimbursed from the COVID money for the expenses we've already incurred before we start incurring additional expenses?
Yes, ma'am. Vicki Frederick is working on those budgets now. And my understanding is that the CARES Act will reimburse the PPE dollars spent so far. Since we used the police budget in the beginning, the CARES Act, of course, didn't exist when this started. And we don't have an emergency fund per se in the county for disasters. So we used the police budget to make all of these purchases. And my understanding is that's going to be paid back. And then my recommendation is that we set aside additional funding for the rest of the year.
Okay, thank you.
And then,
yeah. Yes, ma'am. This came up quite recently in terms of various first responders, excuse me, paying for their own PPE. There was some concern about that. Can you give us the specifics of how that's working? They seem to think that it was they were entitled to free or they were entitled to do whatever. But can you explain that so that everybody knows that we're not trying to gouge the first responders or however that's working?
Absolutely. So if you'll indulge me just for a minute, whenever there's a disaster within our jurisdiction, the Emergency Operations Center has mutual aid agreements with all 88 of our municipalities for emergency management services. So a lot of times we will do the procuring for our municipalities simply because we have the contracts and we can leverage our size. At the end of the incident, as the bills start to come in, if I've ordered 100 tons of sand for the city of Eureka, the city of Eureka is going to get the bill for 100 tons of sand. And that's part of our mutual aid agreements. And then what happens is they simply request reimbursement through FEMA and the Stafford Act. So when this incident began, there was no such thing as the CARES Act, but FEMA put out reimbursement through the Stafford Act relatively quickly. So that's what we were working under. So it was business as usual for us. We were responding and we were billing our municipalities as they incurred expenses. When the CARES Act came around, I think that was when the municipalities and the independent agencies started requesting that they provided PPE through the CARES Act rather than through the Stafford Act, where they would have to pay for it and then seek reimbursement. Does that help?
Somewhat, somewhat, because I don't think the average person understands that when you see a headline, county not taking care of the first responders, or the county is making the first responders, pay for all of that. At the end of the article was the fact that they had FEMA money, or they received FEMA reimbursement. So I'm just trying to get that out so it's clear. To everyone that that there is a pot of money that they've already accessed, or will access, or have access to.
Yes, that is exactly right. And that is actually seeking reimbursement through the Stafford Act is normal business for us during an emergency or a disaster of any kind. So the difference in this one compared to any other is that there's now a different pot of money. And that's where I think some of the angst for the chiefs came in. But I agree, that article did a very poor job explaining all of that. And you're right, the average citizen does not understand how it works.
Okay. Thank you so much. I believe Councilwoman Gray has a question.
Yes, ma'am.
I wanted to talk about that as well, and to reiterate that since you've already discussed it, I wanted to reiterate that the County Executive's Office will be speaking with the first responders, the police chiefs and the fire chiefs, to get an idea of how they want to handle the matter. Or if you want to I don't know if you know about that because you're at the EOC, but I don't know if Shannon knows more about that. And then also, another thing, we do provide PPE for St. Louis County police officers.
Yes, ma'am.
So when you see that on the reports, I want to make it clear that we do provide PPE and such for our officers in St. Louis County.
Yes, ma'am. Also, you're correct. I have a meeting scheduled this afternoon with Doug Moore to go over some language. They're going to compose a letter to all of the area fire and police chiefs. And they're going to, we're going to talk about in that letter reimbursement for what they've paid so far and how we'll proceed going forward under the CARES Act.
Does anybody have any other questions before we advance the slide and the conversation? All right. Yes, I think our.
I appreciate your time.
Thank you so much. We really appreciate you being here, Michelle. And thank you so much for the work you're doing.
Yes, thank you. And thank everyone over at EOC.
I absolutely will. Thanks.
We're going to move on to the humanitarian portion of the presentation for Deborah Patterson.
Thank you so much, Shannon, and thank you for having me this morning. And of course, I want to start by grounding our conversation on the purpose of humanitarian, which is meeting the basic needs of county residents like food, housing, safety, health, and addressing vulnerable populations, children, seniors, the disabled, and the unhoused. So we have a big job. Last week, Cindy went over the decision-making process for humanitarian grant making. And so I thought I might quickly review that with you guys. We are working on an online grant application. We are almost done with our online grant application and frequently asked questions. And we also plan to stand up an email address called humanitarian, humanitarian something. I'm sorry, I don't quite remember, but so people can ask us questions, so applicants can pose questions and we can respond to their questions and add to our frequently asked questions from potential applicants. We will have independent reviewers and county staff reviewers. We're looking for a mix of skill sets, social services, technology, nonprofit administration, health, and also organizations that have close relationships and knowledge of the impacted community. So we will also, as Spring mentioned, be using Recast reviewers as part of our independent review process. And county departments like Human Services and the St. Louis County Children's Fund, I think we should bring in Aging and the Productive Living Board because they have knowledge and experience in serving the affected. We will also make sure that our reviewers are diverse. Then we'll have a group of senior volunteer reviewers, and they're basically looking to make sure that they don't see gaps from a program and geography and equity perspective, and as well as making sure that there are no red flags around the organizations we've selected. Oftentimes, organizations look good on paper, but sometimes they have a reputation for not necessarily being expedient on implementation. And then we would share that information with the council, with the people that are around this table this morning, and then the county executive authorized, and we will post the list on the website. Are there any questions about this process?
Deborah?
Yes,
Madam Chair, may I ask a question here?
Yes, Councilwoman Days.
Thank you. So the county executive, I believe a couple of press conferences ago, announced a food giveaway, which would be under the humanitarian portion of this, correct?
Yes.
And so did they follow this process to make those awards?
So I would say, you want me to answer?
Yeah, whoever can answer. Yeah, that's fine.
I will answer that. You know, it was deemed an emergency. It has taken several weeks to stand up a grant applications specifically around humanitarian. So we did not go through that process. However, we worked with organizations that had a long storied history of food distribution in our community. They have been working with school districts and pantries for a very long time. So they have knowledge about where the needs are. And so we did work with the rapid response team on helping to identify some of these organizations along with the St. Louis County Housing Authority. So it wasn't made in a vacuum, but it did not go through this process. Does that answer your question?
Now, do we know if the awards have been made? I know that he announced those, but do we know that these folks have actually gotten the resources that they said they were supposed to be getting, and has that been posted to our website?
So I will let Shannon address that if she can.
I'm working on things and getting up to speed. We are in the process of drafting the contract. We're accounting for and have, the expenditure noted, but no, the contracts have not been written, to give the monies.
And so Shannon, how was it determined then? Group A got this, Group B got this, Group C got this. How was that determined?
I'll answer that. Are you?
Thank you. Go ahead.
Actually, we do have proposals from those organizations, and so it wasn't like they just said, okay, give us $665,000. They let us know. We know what the food cost is. We have budgets of food costs, of personnel costs. In the case of the St. Louis Food Bank, what the mobile units cost, what the trucks cost. So we did not make this in a vacuum. We had a proposal from the Urban League about how many families they were going to serve, what the food cost was, and we were not paying for any of the ancillary costs. So we did not just award them the money without reviewing their numbers and also who they plan to reach. Is that helpful?
Yeah, that's helpful. So going forward, I guess you're saying there was a proposal from certain organizations, and I guess my question is, how did the organization find out that this pot of money was available for them? I just want to make sure that as we, an accountability committee, as we look at these things, we have the oversight to say, well, yes, I know that was a process, and yes, we followed the process, and so that's what I want to make sure that happens.
You are exactly right, and unfortunately, in a emergency situation, process sometimes comes later, but we are working to stand up a process. So we get ideas and applications from across the community, not just organizations that we know.
Thank you. Yes.
I have another question that I believe should probably fall under the humanitarian bucket. In Councilwoman Gray's meeting, I think that was last week, we heard from some folks that in our hardest hit communities, one of the biggest barriers to us successfully eradicating and moving beyond the pandemic is education. So are we looking at community education and those types of talking about social distancing, wearing masks, keeping things cleaned and disinfectant, and providing supplies to do all of those things? Is that part of the conversation on humanitarian relief?
So, Prepare St. Louis has partnered with, I believe, with the health department, and they have stood up a website about social distancing and PPE. And so they are working, they have community activists on the ground in the community, healthcare workers on the ground in the community sharing that information. In addition, when we do the food distribution, one of those weeks we will be providing PPE kits along with instructions and information to families that have been pulled together by Prepare STL.
Can I speak?
Thank you very much. Do you have a question, Councilwoman Gray?
Yes, a couple of things. On that same vein, we have a department or a leg of the county executive's office called community engagement, and I think they need to be included when you make decisions on the on funding. They are out in the community and working with the smaller municipalities and the unincorporated areas, primarily unincorporated, of course. And I think that would be a good area to consider as well. In the same vein as you just mentioned, like Prepare St. Louis, putting people out in the community. Now, I haven't seen the volunteers, and I really wasn't aware of Prepare St. Louis until maybe a week or two ago. I have seen signs in one of our churches in the area. So it would be nice to engage. I guess they're working with Department of Health, but the Department of Public Health, but the community engagement offices, they kind of work with us better, and we would probably get more information or be more informed, and we could be inform them more about our community if they were included as well.
Well, I have two thoughts. One is maybe to connect them with Prepare STL, so they understand what Prepare STL is doing. And I received, Cindy received a note from your assistant about, is this a mutual aid organization?
No.
That's a different organization?
Yeah, that's an organization, a nonprofit. I was talking about a county department called community engagement, where they're staffed by St. Louis County employees.
So I will ask Shannon who the contact is for that, so we'll talk more about that, but I appreciate your input. And then I think we should connect Prepare STL with the community engagement people, and maybe also with the mutual aid organization.
Yeah, mutual aid, that was just something that came up during the Urban League food drive. So Adrian just thought it was something I know nothing about them.
Oh,
So,
okay. All
nothing
right.
at all.
Thank you.
But I also wanted to add, I did contact the people who received or are supposed to receive the food donations for food. I talked to several of them, and they have not made any decisions on how they're going to utilize the money. So it's still a lot up in the air with regards to that announcement last Wednesday, to my knowledge.
Well, why don't I proceed and then talk a little bit about where those funds will be deployed. I think there are a few things up in the air, but I don't think that everything is up in the air about this. The contract hasn't been signed, but the work in terms of school districts that Operation Food Search will be working with, we know the library sites, we have the LinkedIn, the link market sites. Yeah, we have those sites we know where those are. The zip codes, where the mobile units and some of the sites, but we haven't picked the sites yet, but we actually have the zip codes where they would be deployed to help fill the gap on food deserts. So do you want me to jump over another page and talk about that?
Yes, please do. Thank you.
So I was also asked about my advisors. Who were my advisors? So I want to say this when we put these slides up. I'm talking to everybody. I don't know everything, so I'm talking to whoever wants to talk to me. And so I'm the regional response team, which has over 50 nonprofits. I sit in on those calls every Thursday at 3:00. I've been sitting on those calls, and they have member organizations that I've outlined here, everything from the United Way, Regional Health Commission, to the Integrated Health Network, to Catholic Charities, to the Behavioral Health Network, to Prepare STL, United for Children that deals with child care centers, Missouri Foundation for Health, Beyond Housing, the St. Louis Regional Homeless Network. So a lot of the organizations that are charged with meeting the needs of the community are part of the regional response team. So that's every Thursday at 3. And then today at 1 o'clock, the Regional Business Council also has a group of stakeholders, many of them funders, corporate funders. So understanding where they're putting their money. So that's on Tuesdays. Then I have a standing call with some of the, with Prepare STL on Monday morning. So I'm saying this to say, I'm talking to folks. I've got my ear to the ground. So Shannon, let's go to the next slide. So these people, the Humanitarian Advisors, these are people that are kind of formal. They're formal advisors. But as I said, there are, I'm getting information and education from a myriad of places. But Starsky Wilson, you all know Starsky by his reputation. He will help us keep our equity and access lens on our work, on our giving. Bethany Johnson Jarvis with the Integrated Health Network. I don't know if you all know her, but I know her from Forward Through Ferguson, and she definitely has her pulse on the needs of the disadvantaged in our communities. Hazel Mallory. Hazel is retired. She was the vice president of Head Start and Early Head Start, and worked in this area for 15 or 20 years in the area of child care. Sandra Moore, who's now with Advantage Capital, but she was the CEO of Urban Strategies. And so she has a wealth of knowledge around housing and employment. Mary Campbell, who at one point in time led the Community Development Agency for the county, led neighborhood revitalization for the city, was a senior vice president for, I think it was US Bank, in their community development area, and now is an associate. She's now at Washington University and in charge of all their off-campus real estate development. So she comes with a wealth of knowledge around housing. And Chris Pickle at AT&T. So one of the things that we've heard is access to technology, hotspots, and would be important if we're going to try to stand up education and people having access to telehealth and other things. So Chris Pickle will connect me to the right people in AT&T that would give us some advice if we need it. But as I said, like yesterday, I talked to Wendell Kimbrough at Arches, St. Louis Arches, and I don't know if you guys know that organization, but they are the state's organization that does all the training and technical assistance for child care centers. I wanted to try to understand what they were seeing, so I have to talk to his director of child care. Tomorrow, I'm on the call with the American Heart Association because we have a child care initiative around healthy food, but they're going to be talking about COVID-19 and the health centers that they support that are primarily in the affected zip codes. I was consulting on that work. I am no longer being paid, but I asked if I could sit in on that call so I could learn. So I'm just trying, hopefully this gives you a sense of how I'm taking in information to try to do the best job I can to meet the needs of the St. Louis County residents. Are there any questions? Okay. we just talked about the $2.6 million that was invested into food access. And I just want you to know that the approach to food distribution was made with a lens on equity and access to ensure the most vulnerable communities are at the center of this response. And close to 1.6 million meals over 15 weeks will be shared with our community. It might be 1.7 because there's also the 85,000 with the Urban League. So I'm just going to take a little deeper dive into a couple of these.
Before you do that, may I ask a question, Madam Chair? And I think
Yes,
it goes,
Councilwoman Days.
thank you, because I think it goes back to the question that I asked earlier. I see a big discrepancy in these numbers here that we're showing. So my question again was, how was this decided that the Urban League gets $500,000 and Operation Food Search gets 1.3 million? How was that decided?
So they're serving many more people than the Urban League is serving. There's in terms of the numbers of meals. So that's how that was decided. And the same thing with the St. Louis area food bank, and the Urban League is also leveraging corporate dollars to fill out their approach. So, and Link Market, this is the number, this is their exact number for standing up 4 pop-up markets. Whether or not we do more pop-up markets in the future this is kind of our first foray into this, but it was based on how many meals, how many people they were serving.
So Lincoln Market could potentially, let's say if they got $500,000, they could potentially serve more people, but it's based on their past performance, if I'm hearing you correctly?
I'm saying based on what we received from them to serve 4 sites. That's the budget that was submitted to serve 4 sites.
So what, Deb, I think what I'm hearing you say is that Link Market requested 110,000.
Yes, that was what they requested.
Right, and that's what I was going to add, because I believe.
And I talked to Michael. I picked up the phone and talked to Michael about the Urban.
Right, I was going to add, I believe that Mike indicated how much he would require or request. And I talked to Link Market as well, and they told me they were a very small organization. So I don't know if that's why. I'm just saying that's what they told me. So that could be why. I don't know if that's why. That's what she told me.
And Pot Bangers is small, very small too, but they were meeting an unmet need around the unhoused.
She's doing a lot of great work with Pot Bangers.
And you think she could probably do more if she had more money, but so it goes back to the process, though. It goes back to the yes.
Rita, we asked to submit her proposal. This is what she submitted.
Okay. All right.
We asked Link Market to submit their proposal. This is what they submitted. I picked up the phone and called Michael about the Urban League. This is what he submitted.
Okay.
So,
all right.
Okay.
I just want to make sure I'm clear as to how this is, because it seems the bigger the organization, they get the most, and we don't know what the capacity is of these others. And so that if you did that's fine. I'll have to accept that for right now.
Thank you.
Thank you.
To the question of additional, how we would meet the needs of additional food deserts, the food bank proposal also had 10 mobile units that would feed 300 families. And so those will be deployed in areas of high need. So one would be at the Center for Youth on the Rise in Spanish Lake. And then I went too far. Let me back up and say, here's how we decided on that. Income levels below the poverty level, zip codes where COVID-19 had a disproportionate impact, and zip codes where African Americans make up a significant portion of the population is where we will deploy those mobile units. And one site is the Center for Youth on the Rise in Spanish Lake. The zip codes are 63033, 63034, 63121, 63130, 63133, 63136, 63137, 63138. While we don't know the sites yet, we do know it will be in those zip codes. Are there questions, or we could go to the next slide? So, talking about food RX, Link Market. Was there a question? Okay. Link Market, the program we're supporting is our pop-up grocery store and pre-order program. And this is focused on communities that are high density, low income, great risk for obesity, diabetes, high blood pressure, disease, and in coordination with the St. Louis Housing Authority. 4 sites were selected: Bell Fountain Recreational Center, Fifi Manor Apartments, Villa Lago, multifamily senior apartments, and Wellston Place senior apartments, multifamily senior apartments. So that was with, in collaboration with the St. Louis County Housing Authority. Can we go to the, are there questions about this? Can we go to the next one? The next slide. What I wanted to show you is where all the food distribution sites are for St. Louis Area Food Bank, for Operation Food Search, for the library, and the one yellow dot is where Center for Youth on the Rise. And as you can see, most of the dots, the majority of the dots, the intensity of the distribution of food are in the areas of highest need. And to the question of, are we going to do more for food deserts? What I would say is we need to have an opportunity to see if what is planned is going to work. Because what I have heard is there is food, there will be food, but what we are missing is communication, so that our community understands where all these resources are and where they're available. So we really need to focus on getting the information out about where services are. A lot of people don't know anything about 211. They don't know that 2 blocks over and down the street is a church with a food pantry. So that's the next step I think we need to really focus on is communication, whether it's about food or about public health, or if it's going to be about housing, or if it's going to be about childcare. We need to focus on communication next. Are there any other additional questions for me?
I don't think so. I think if anybody has any more humanitarian related questions, now's your opportunity. Okay, I think we're ready to move into the economic recovery piece. Shannon, are you going to cover this? We're going to have lots of questions here.
Yes, I will do my best to cover this. knowing that there's a lot ongoing. So these efforts are focused on reviving the local economy. And the next slide will provide an update on the most recent activity with the Small Business Relief Program that we recently extended the deadline to one. Everyone should have received notice of this. The council recommendations would then be assembled by June 15. And we are in the process of preparing to assist with the program rollout and working with the council to provide updates. I can stop there. That's generally the status of the program. And if we want to talk through the specifics, happy to do that.
So my first question is, and I hope I'm speaking on behalf of most council members, we feel that this application deadline was extended without our input, and many of us have a lot of concerns about those businesses who are just barely hanging by, and have been expecting to get relief sooner than now, what may be July 1st or July 15th. Was it taken into consideration that we had that this lifeline that people have been depending on has now been pushed back?
I think the idea with the extension is that while it pushes the deadline out, that doesn't necessarily mean we can't begin the processing of applications in advance of that. So we'll keep it moving as best we can and be proactive in that way.
So are you saying that if, I can get through all of my applications to date by the end of this weekend and can start rolling you decisions by early next week, then you'll move that process along more quickly?
I think we are assessing how this is going to work. And yes, we would like to be able to begin the process so it doesn't all get pushed over the deadlines and pushed back. So we're trying to see how we can do that.
Talk a little bit about the process for how the decision was made to extend the deadline and why this oversight committee at the very least wasn't really consulted.
On that particular piece, I don't have a lot of information, but I'd be happy to follow up with you all about it.
Okay. Do any other members of the committee have questions about just this piece?
I do, Madam Chair.
Councilwoman Days.
Do we have the application? Is the application right now ready? The application was fraught with mistakes, changes, all these kinds of things. And so it made it, in my mind, difficult for someone to have already applied. And then all of a sudden the application changes. And I was told that that we're going to, well, initially I was told that the people had to reapply, which is asinine. They should not have to reapply. This is for the process that you put in place, and they followed that. So now I hear that we have added some things to the application or changed some things to the application, and that I believe the IT department will go back and try to get better information, if you will. Is that correct?
Yes, that's correct.
Okay. So these people do not need to reapply.
I'm sorry, I thought you meant on what's already taken place. I believe there has been some piece that there has been a reapplication is necessary, but IT is also making the changes and going back to complete the information. And it's ongoing, Ms. Days.
So either way, the people who have applied and reapplied, then I guess there will be, now this is a humongous task you're asking. And so that's why I want to make sure I'm hearing what you're saying. So if these folks have applied, they have reapplied, then someone from IT will go back and I guess validate all the information that they have received.
My understanding is that our IT team is working on that to validate the information that's been received. Yes, we're aware of those glitches and we're trying to understand how we can fix them, how we can validate the information with IT. And our intention is to be in communication with the council regularly about how that's going. And I understand it needs to take place immediately.
I see Chuck on the line. Chuck, can you reiterate? Oh boy. Can you use a big word? Okay, Chuck, I need to hear from you, please, on that subject.
All right. So the reason why people would have to reapply instead of edit is because we're not asking them to log on. So there's not a user account or something that they would be able to reference their applications. We do have a problem with addresses. My team is working on that right now to try to rectify that, to make sure that every business has the correct address in place, so that when you're looking at it from your district, we can make sure that you're only looking at the things that are in your district and eliminate those mistakes. One thing we cannot do is if somebody has, say if a company has, changed their mind and maybe they wanted 5,000 and then they came back and said, I really need 7,000, and they submitted a second application, IT cannot discriminate between those and determine which one is real or which one is not.
So is that going to be part of your process? If you see two and they're asking for different amounts, is that part of your process as well? Okay, what are you asking for?
No, IT is not looking to go back and query the company as to which one of their applications is accurate. We're trying to make sure we give you all the data that was submitted that was accurate.
So that will be incumbent upon. I'm sorry.
No, it's okay. Go ahead and finish your thought, please, Rita.
So it will be incumbent upon, I guess, the council member and the team that we put together, if we have one, to determine that we have two applications for the same person, and then we will have to make that decision. That's what you're telling me.
That's correct, because IT is not going to be in the business of trying to tell you exactly what these people are asking for. That's not something that I can do with any certainty and be able to validate.
Okay, thank you.
Councilwoman Gray.
Okay, thank you, Councilwoman. So, Chuck, will we be able to determine which, if someone submitted two applications, will we be able to determine which one was submitted first?
Yes. Each application has a date attached to it, so you can see that the date that the application was submitted.
And what was my other question? Oh, it was mentioned that some people have to reapply. Let me get clarification. If the applicant made a mistake, such as they put the wrong address, then I can understand they should be required to redo the application because it was their mistake. But if there was something wrong with the actual application, what are you going to do with those people? You said they don't have to reapply. How's that going to work again?
So we have every application. So if there was something, if there was say if somebody changed their mind and say they decided they needed a higher dollar amount, there's no ability for them to edit that.
Right. So I'm referring to errors that were on the application itself. I think you changed it, right?
We have modified the application on request to make some of the fields more clear.
So but they don't have to reapply, I guess is what I'm trying to get at. Or do they?
Only if they need to change data they already submitted. So nobody needs to go back and reapply. Yeah, nobody needs to go back and reapply unless they submitted data and they want to go change the data that they submitted, like a dollar amount or something like that.
The new application would only apply to people who filled it out after it was changed, basically. So if you already filled it out, you just have to deal with the old form.
Correct.
Yes, or we have to. Okay.
Madam Chair.
Councilwoman Days.
Chuck, the address part of that, what was the confusion around that?
So the problem comes in is that in the application, we put an interactive map in order for people that when they type in their address to get a visual of that address. And so they could, if they typed it wrong, they could see where they were at. But if you're doing that on a phone and when you tried to scroll up or down, if you were touching the map like with your thumb, like, if you can see it, but like this, if you touch the map, you would end up putting that little dot in the wrong spot on the map. And so that dot became the address that was captured instead of what was typed in. So that's the problem with the addresses. And we are going back and we are correcting that.
Did you have any problem with the address of the business versus the resident? Did you have any problems with that?
Not that I'm aware of.
I could be conceivably living in the city of St. Louis, but I have a business in St. Louis County. Did we have any problems with that?
Not that I'm aware of, because we did ask specifically for business address.
Okay.
I don't know who this would go to, Chuck or Shannon. The jurisdiction portion of the application was confusing for some people. Well, I guess probably a lot of people. And has that been rectified? I don't know who's answer these questions.
I don't have the answer to that question, Chuck. Do you?
No, because jurisdiction, I do believe, is supposed to be really their city or unincorporated, which once we have the addresses fixed, we can actually tell that data from their addresses. But I don't believe anything further has been done on that as far as the application goes or guidance to people.
Okay, I'll talk about it. I'll talk about that later.
So it's partially a question, partially a comment. So can I please ask that when the county executive's office has a great idea that is going to put a tremendously burdensome amount of work on council members with no guidance or rubric or any knowledge or background of grant making, that you ask us before you just make a public announcement that this is going to happen, because there is a lot of confusion. There's a lot of disparity in between how one district versus another is going to award these grants. And I know in a slide coming up, we're going to see the disparity in application number district. But this, good idea, no thought as to execution. And our constituents, the businesses in our districts, and we are suffering for it. And I think that next time, if there is a next time, we should be looped in before just given something with no guidance.
Thank you, Madam Chair. It's well taken. I appreciate your comments.
May I
Please,
say
Councilwoman
also,
Days.
Thank you. May I also say that, that will be a next time. We want to make sure that when these things are rolled out, that you have considered everything. And I think in that decision, I don't think that there was one elected official in that process while you were making these decisions. And so to the council chair's point, that we are the ones that are on the front lines of this. And so you won't be answering any questions about this. We will have to answer the questions. And so to not include us in there is not appropriate. And so as we move forward, I know we're looking at child care and other things like that will be coming up. So before that's rolled out, it would be appropriate to pull us in that process. This is why we're an oversight committee. We're not window dressing here. We want to be part of the process. So thank you.
Thank you. I understand. And we can be proactive about the communication and open and transparent. So I look forward to doing that.
Yes, I wanted to reiterate that I've had many conversations with many different people about this as well. Something else we need to keep in mind that when you make announcements, and of course I'm just being general, when you make an announcement, people hang their hat on it because people are very desperate right now. I understand why. So when we put things out, it has to be pretty much ready to roll, because we're getting calls such as Link Market. Where can I get the food from Link Market?
Yeah.
People are very desperate right now. So when we make an announcement, believe me, people think you mean tomorrow, maybe today. They may think you mean today when they get off the press conference. So we have to be cognizant of the fact that when we can't just put information out because it sounds like a good idea, because it is a good idea to them, especially, and they want it now. So that's something else to consider before we make announcements.
I understand and I appreciate that. I agree. Thank you.
Let's go on and let's talk about the number of applications submitted by district and the dollar amount, because we can see a huge discrepancy here.
That's right. And so the next two slides look actually fairly similar in terms of, you know, a large number in District 3. And so, Chris, if you go to the next slide, you can see the dollar amount pretty much corresponds with the bar graph here on both. So that generally gives you a sense of the way this is shaking out. I will say that after some conversations this morning and the issues with the addresses, it looks like we may not actually have this disproportionate amount in District 3. So we need to get to the bottom of that. So it may look more evenly distributed once we can get through the address issue.
So can you talk about how much is available for this program as opposed to how much has been applied for?
Total applications are around 34 to 35 million. And the total amount available for the program is 17.5 million, allocated at 2.5 million per district. And so in some districts, you're not quite at that 2.5 million threshold. And others, obviously quite higher. And then we still have a block, in addition to the address issue, we still have a block of applications where it's not been assigned to a district, where the jurisdiction's unknown at this point. So we have some work to do in terms of figuring out where folks fit in.
And is there anyone from, you know, your team or the county executive's office that can lend support to the extent there are those of us who have no grant making experience and need some support?
So one of the things that we've talked about is how can we make this process go better? We you know, fully acknowledge the issues that there've been. So I think this week we're going to spend some time working on what the process should look like, next steps, and really understanding what you all will be going through as you assemble your recommendations. And we're looking at possibly having some kind of technical assistance training for your team, you know, and give you our sense of how all this should take place.
Are there any other questions about the Small Business Relief Program?
Madam Chair.
Go, please. Well, Council Chairwoman Clancy.
If there is going to be any technical assistance or anything like that provided, I mean, I think that's a good idea, but the sooner the better, and some clarity around those dates would be very helpful, because, you know, a lot of us are already, you know, the train's out of the station in terms of thinking about how we are going to be doing the evaluation of this and all of our applicants. And I am concerned that there could be additional guidance coming down that could then be in conflict with some of the decisions that we've already been told are the discretion of the council members themselves, for example.
Okay.
You know, if that's going to happen, I think it needs to happen like by the end of this week, or at least tell us when.
Sure, I understand. And I don't think that we would do anything additional that would conflict or make it more difficult for you. I think we're trying to get a sense of what you all are faced with in terms of processing this and help think that through and standardize that so everyone has a general sense about what the steps are and how we're going to process this. I guess essentially really thinking through all the steps that need to take place and getting everyone on the same page about that. And I think that will bring some organization to the rollout and kind of get folks moving in the right direction forward.
The other thing is also, I believe last week, Ms. Brinkley mentioned an evaluation rubric that perhaps was going to be provided to council members. is that something that is in the works?
I have not heard of that at this point, but I wrote it down and I'll take it back to Ms. Brinkley.
Okay. Again, that's something that would be really important to see because, you know, I'm already digging in and creating my own evaluation rubric. And if there's going to be one that's going to be suggested to the council members that we use, you know, perhaps to have some standardization across these decisions, I need to know that, like now.
Okay. Got it.
Can I interject?
I think Councilwoman Days had a question too.
Okay, I don't have a question. I wanted to follow up what she just said, but it's up to you.
Go ahead. Go ahead, Councilwoman.
Shannon, did you say you don't know of a rubric or there is no? I'm not clear what you meant.
I have not had a conversation about a rubric associated with this program. That's
okay, because
just
she
me,
did.
but I will ask the question of Ms. Brinkley.
Okay, because it was mentioned on last Tuesday, and I was expecting it like yesterday, to be honest.
Okay, got it. I will ask her about it.
Okay, thank you, Councilwoman Days.
Thank you. I had a quick clarification, if you will, and I thought I understood Shannon to say that if we had already made some decisions about these businesses, that those would be that the payouts would go to those people already. Now with the extension, someone could come in on what is extended day, May 5th, May, June, whatever, and be eligible for the funding, but we've already made a decision earlier. Can you clarify that? Because I thought I heard something totally different than what you're saying now.
I was simply saying before about extending the deadline, just that if there's a way as we begin to think this through and really, you know, put the details in place, if there's a way that we can process in advance of the deadline and keep things moving, we're going to try to make that happen.
Yeah, I'm just not sure if it's fair to perhaps a person who's applying late. They see the extension and then they apply late.
Right.
Not sure how that will be handled. So
I hear you, and I think that's a very valid concern. So we need to, you know, really put serious thought here and think through each of those pieces and how we can best administer under the various parameters that have been set out so far.
Yep. So that also leads you to understand why the rollout of this, although just quickly, you did not go through the necessary steps it took to answer the questions that we had. And so that's why we're having, you know, so many issues with this. It just was not completely thought out, you know, I think as it should have been. But neither here nor there. We're here. We have to move forward with what we have. So let's just try to eliminate as many of the confusing issues as we possibly can. So that's all. Thank you.
Thank you.
Okay, so I want to talk about childcare. As I mentioned in my opening remarks, we can't have a serious conversation about reopening our economy without also talking about childcare. And just to give some context from a personal perspective, really lucky. My day job employer is like, if you're fine working from home, don't come back until there's a vaccine. My co-parent's employer, AAA, on the other hand, is like, you have to come back to work. If you don't have childcare or you have you live with someone that's a high risk, too bad. And I understand that we can't tell businesses how to run, but the fact that that can even be part of the conversation in 2020 shows me that we still, as a society, have no value for the mostly women who love and support and educate our children and who would be taking care of the children whose parents need to go back to work and whose parents want to go back to work. And there is a cost issue here relative to all of this, where daycare centers are already barely surviving. We pay early childhood education providers live at or right at or just above the poverty line so that we can all go off and have our jobs. And that is not going to work right now because they're requiring more people per kid, social distancing, all the cleaning that's going into place. it's just an unsustainable business model. It was an unsustainable business model 6 months ago, and now it's just completely untenable. So how are we looking at this? What kinds of proposals are we considering? And what type, who all is talking about this? Just an overview picture, if you will.
I'll just take a crack at this. We had always, as part of humanitarian, thought we would support child care. We hadn't thought through exactly how we would support child care, but it was one of the focus areas of need. We understood that. Now the question is, because when the correspondence, when the demand letter came from child care advocates and for $27 million, $6 million in PPE and $21 million in child care support. Well, I should just say, I was just like, oh my God, where is that going to come from? And so we have to figure out, because right now, I don't know what the humanitarian budget is going to be. So, and with all the other things that people need, like shelter, we're going to have a huge housing issue too. And so so we will be faced with, how do we balance all of these competing needs? We have mental health issues, so it's and access to technology, so people can actually look for a job if they've lost their job. So I'm just saying, today I'm not quite sure what we're going to do, but I think we need to prioritize like what is most important in this. And then the request was to support childcare over 7 months. We haven't done that for the small businesses, and many of the childcare providers are small businesses. So I think we have a lot to think about. We also need to understand what the state is planning to do in support of childcare. And I don't know what that $6 million in PPE is. It may be bigger than Spring's whole budget. So we need to step back and be thoughtful and do what we can within, I don't know what our budget is. As much as we can for childcare, while we also have to support all these other needs. And you know, so that's kind of where. And let me just say one other thing. So they're having. So how do they source cleaning supplies? If they're having trouble, does it make sense for us to try to source them and distribute them? Because even if they get the money, will they be able to get what they need? So that's why we need to take a breath and figure out our path forward.
Chairwoman Clancy.
I know, and I've talked to Deb, I've talked to some others, you know, over the past few days about this issue. I echo everything that Councilwoman Dunaway said about the importance of this, and I agree that there's a lot of alignment and consensus around this being something that is absolutely fundamental to support right now, especially for our economic recovery. And in response to Deb, I agree that those are important things that need to be thought out. However, I am also concerned that if we continue to take time to think through some of these things out, to think through some of these things, we are going to be, our budget is going to be continue to be set aside for other things. So and perhaps some of these things would have been worthwhile to think through for the small business relief program, and we didn't, but we set aside a huge amount of money for this program. And we're kind of rethinking some of that right now and having to make some decisions maybe later than we should have about that. But the point I'm trying to make is perhaps we could at least set aside a significant amount of money for this purpose and reserve it and know we're going to use it, even if we're still figuring out some of the details. Because I am concerned that our budget from the CARES Act is going very quickly. And if we continue to take time to think through things, we might have our thoughts gathered and decisions made, and we won't have any money left.
Is it okay if I respond? So I don't know how much we have to spend. So, and I'm not in control of the budget. So, once we have a number, then we can figure that out. But all I'm saying is today, I don't have a hard and firm number to be able to say, based on what Humanitarian has received, this is what we are going to set aside. I don't know the number.
Madam Chair.
Councilwoman Days.
Thank you, Deborah, for that. What you have done in my mind is bring forward a major problem with this. We don't know what we have. We don't know what each pocket of the three pockets, the three buckets that we have. We don't know what the allocation is for any of that. And it makes it extremely difficult to pull forward and move forward with these initiatives where we have no idea what that is. Now, where does that come from? I'm assuming it comes from the top people. So without having that information, it's extremely difficult, but it still does not negate the fact that we need to address this issue sooner rather than later. Now, I do know that a lot of these small businesses that have applied, particularly in my district, or child care facilities. So if we have some carve out for that, maybe that will give us a little more money for the small businesses, the other small businesses, but we don't know that. I do know that the state is behind in its reimbursement for these. I've had those conversations as well. The state is behind in their allocation of these child care facilities. So it kind of, I guess it just moves, it reiterates the point that we're almost operating in a vacuum here. And that is extremely, extremely uncomfortable for me. I'm done.
Councilwoman Gray. Thank you, Councilwoman Days.
Yes, I had heard about this a few days ago, and I was I don't know if the word is concerned, but I was at the I guess concerned that they would be getting money through the, like Councilwoman Days mentioned, that we have the funds to give to daycares, and they're also going to get money otherwise. So I was wondering about that also. And I haven't seen the letter, and I've been out of town, so I could have just missed it. But I would like a copy of that letter as well.
What letter?
The letter that Ms. Patterson said she got. For how much money did you say the request was?
I think in total it was close to $27 million. Yeah.
Or the information, however we can get it. I wasn't aware of the amount and any of that.
We'll make sure that you receive a copy of that. And so there's.
Yeah, I don't want to, I do not want to stop talking about the importance of childcare and how important it is to be able to reopen the economy, but we do have other questions. We have questions about the $40-ish million that the municipalities have requested for support. Can you all talk a little bit about that?
Do you all have a specific question? And I wonder if Michelle Ryan is still on the line. If not, I can speak to it based on what I know. Do you have a specific question?
No, I think I just want to understand, what is it that they want the money for? And what is the process that we are going through to determine whether they're going to get it, how they're going to get it, how we're going to monitor how they spend it, whether there's any reimbursement from FEMA or other means on the other side of this, and how that $40-ish million is going to affect our ability to do something meaningful with childcare and additional economic recovery here.
Right. There was a letter last week from the county executive requesting to put $47 million aside while we figure out what expenses are allowable under the CARES Act. I believe there was also a copy of the letter that was sent to the Department of Treasury requesting clarification. Some of the guidance that was issued on the CARES Act last week raised the question of whether or not emergency personnel expenses were allowable, and whether or not, our jurisdiction can transfer that to a smaller jurisdiction. And the request for the $47 million came from the municipal league, and that was their figure. I believe it was a 4-month estimate for emergency personnel expenses, including fire. And so that was set aside until we have an answer to that question. There's also a question about PPE and the reimbursements there that I think Michelle Ryan would be able to speak to more eloquently, but is tied to the issue I think that was raised earlier about the reimbursement under CARES or paying for it under CARES versus being able to be reimbursed from FEMA. So, and I think as this discussion illustrates today, anytime there's a set aside for any purpose, it begs the question about what the priorities are and which you will fund. And so childcare is certainly an important priority as well. And I think they all need to be considered and are being considered.
Does anybody have any other questions about the Municipal League's request?
Was their request for all municipalities or only certain ones who participated in that request?
I want, since it's from the Municipal League, I want to say it's an estimate for all, but I haven't confirmed that with Pat Kelly, and I would need to. Would you like for me to?
You don't have to. I don't. Unless somebody else wants you to.
Chairwoman Clancy, did you have a question?
Well, I don't know if this is something that anyone on the call could answer necessarily, but I am curious about where the municipalities landed at this figure of $47.5 million. What does that include? Genuine question.
That's an estimate of their personnel expenses based on law enforcement, the expenses that they've had over a 4-month period, and then an estimate of what fire districts would need as well. So it's a combination of those numbers.
Do they have it broken down any more specifically than that, though? I mean, are we talking overtime? Are we talking things specifically related to COVID response?
So I believe it would be related to COVID response, but not limited to overtime, because that was the question that was raised in the guidance is, whether at least I believe that's how my interpretation, that it was regular expenses that were related to COVID. Regular law enforcement personnel expenses related to COVID as opposed to the overtime. So it was the budget of personnel.
Do you know what an example of a regular expense would be related to COVID?
I mean like a regular personnel expense related to COVID. So if the officer's time was spent responding to COVID instead of just the overtime, I believe that's the question. And if someone has information to the contrary, please let me know. But I believe that's the question.
Again, I don't know that you have an answer to this, but what does it mean for an officer to be responding to COVID versus that being something that is not a part of everything that an officer does? I don't know if I'm asking the question the right way, but.
Yeah. Okay.
I have something.
Councilwoman Gray.
Yes, I wonder, and I don't, again, this probably won't be answered right now. Has anyone investigated or inquired about the federal CARES Act money that's coming down to the munis? I've seen information coming from the state that there's a committee or something was formed, I believe, through the treasurer's office to address the municipalities. So, and like I said, this may not be something to really answer right now, but it's important, I think, that people inquire of the federal funds so that there's not a misconception that there's no other monies coming to the municipalities, because they should be getting other funding. And Councilwoman or Chairwoman Clancy mentioned a lot of not discrepancies, but things that are not clear about the request. And I know if they apply for federal funds, FEMA funds, that those requests have to be very detailed. And so I'm sure that information has to come from somewhere prior to getting any funds from anywhere.
Madam Chair, may I speak to that, please?
Please, Councilwoman Days.
My information is saying that there was a proposal coming from the House, coming from Congress, and they did include municipal reimbursements or support, if you will, for during this COVID pandemic. However, I understand as well that the Senate is not in a mood to take that up and will not be addressing any needs that's coming to the municipality. At least that's what I heard yesterday. Now today may be totally different, but I think that to put our eggs in the federal basket at this particular point, waiting on additional stimulus or recovery probably is not time well spent. But that's the information that I have. I also want to look at too the sustainability, if you will, of these munis. I'm in conversations with quite a few people and looking at the sustainability of the munis after this process. And looking at how that's going to work out, particularly if we're looking at the law enforcement piece on this. That's going to be because that's mostly is the biggest part of their budget. It's personnel. We all know that in any organization, it's basically personnel. And so my concern is how we're going to move forward with that. I'm looking at that as part of the economic response update that we have here. So I just want to know that I'll be bringing something like that forward in the future, but right now we need to address what's on the table, but I just wanted to throw that out. Thank you.
Thank you, Councilwoman Days. Oh, please go on.
I was going to respond, but let me check first and then I'll respond.
Okay. Is Spring still on the line? Is that a no? Chris, do you see her?
It looks like she's left us. I do not see her still here.
Okay. I mean, we have some questions about, well, maybe Dr. Hensey can help us with this one. I don't know. You're in the public health. This may be more of economic recovery, public health, but I see that BJC laid off an additional 3,000 people today. And I'm just wondering how much longer we're going to keep Councilwoman Clancy and I talked about this yesterday. We really struggle with the balance between reopening the economy too quickly and also continuing to watch it crash and burn from a distance. And, you know, I don't know where the right balance is to strike, but when we're seeing healthcare professionals losing their jobs, it's really alarming in the middle of a pandemic. And I get it's because we are trying to keep people out of the hospital that don't necessarily need to be there and keeping, you know, non-emergency procedures from happening. But what's the timeline for reinstating these types of medical procedures and activities so that we can get folks back to work?
Well, I think if Spring were here, she would tell you that it's a stepwise process, and each time we make a change, it will take 2 or 3 weeks at a minimum to see what the effect of the change is. And I think that's, I mean, this is the second day into the change, so I think it'll be another probably 2 weeks at least before we see what the impact is in terms of case count numbers and so forth. We've already begun a dialogue with the health systems about beginning to perform elective procedures and so forth. And I know that as soon as people believe it's safe, they'll resume those activities.
Okay, thank you. Does anybody else have any questions about that piece? Okay, so the next thing on our agenda, I think there was one more. Did we get through all of the slides, by the way?
Yes.
Okay, all right, great. And the last thing is the list of itemized expenses that we were highlighting this week that we wanted to talk through. And I know we did some of them earlier with Spring and with Deb about some of the, and Shannon about some of the expenses. One thing that's not on here that came up separately, and I apologize for not giving anybody any notice about this, but we saw, one of our assistants saw some escalator demolition project that was falling under some kind of an emergency. And it was, give me 1 second, several millions of dollars, I believe. I may have to send that to you in a separate email because you're probably not going to know off the top of your head, but we keep seeing these wacky, really large expenses seemingly unrelated to the CARES Act or anything COVID related, yet they seem to be slipping into these budget numbers. And we want to understand why that is.
Okay. Yes, please send me whatever you have. I'd be happy to look into it for you.
Okay.
And no, I don't know what that is off the top of my head.
Okay. And I know we talked a little bit about PPE at the beginning, but how do we know that we're getting the right equipment into the right hands at the right time? I mean, it's 6 months or 6 years down the road, are we going to find a warehouse that's full of PPE that never got used because it was purchased and thrown in some stockpile while we're going and paying over market somewhere else? I just want to, you know, you hear these stories all the time, and I just want to make sure that we are staying up in front of these expenses and ensuring that we are getting PPE where it needs to go when it needs to get there. Was there not a question in there?
Oh, I'm sorry. I would probably defer to public health to answer that question. I don't know if Dr. Hinsey, if you have a response there.
I do not personally have any other questions. Councilwoman Days.
Well, did we have a response to that question? I didn't hear an answer to your question.
Me neither.
Dr. Hinsey, do you have a response on the PPE and assuring that we are getting it from the right places and we're getting it to the right people? I'm sorry, that's not something I have expertise to be able to answer.
Well, I think when Spring responded, she mentioned the process through which we acquire PPE and keep a stockpile of PPE in the county for this kind of thing. And yes, they try to vet the vendors as best they can. In terms of estimating use, they look at, I'll say, burn rates and try and discern how long those will last. And there is a sort of mathematical calculation about the type and the amount of protective equipment that's purchased. And the county also maintains a stockpile. It's, you know, so before expires, you want to expires according to the dates, you want to use it. You always want to have a stockpile. And I'm relatively new here, but I know there's a very thoughtful calculation made in order to try and determine what's the need and what the burn rate is. I hope that helps.
So you're saying that some of these expire? Masks expire?
Yes, there's an expiration date on almost all medical equipment. The expiration date may be years down the road, so I'm not close to that for the equipment that's been purchased.
Okay, thank you. Sorry, Madam Chair, I didn't mean to jump in there. I just.
Oh no, it's totally fine. Are there any other items up for discussion from members of the committee or from members of the County Council?
I have one other one, because you asked the question about the escalators. We need to get some idea of the time frame that we're going to get that information before that expenditure is made. We need to find out why that is an emergency. I think they're talking about 41 South Central and the escalators that were boxed in. I did not get a good response to your question there, Madam Chair. So we need to have a specific deadline on when we're going to get the information before we make that decision, as that's an expenditure that we need to approve of.
Yeah, I think that's a good point. And Shannon, can you make sure that we get some information about that by next week's meeting?
Yes, of course. And Councilwoman Days, as soon as you said it that way, I thought, oh, right. Okay, yes. So I know what you're talking about. Yes, we'll get you the information as soon as we can.
Thank you.
Okay. Any other comments, questions? Okay. Well, we had no public comments this week. I would remind the public, we certainly want your input. We'd love your comments. You can send us your comments up to 24 hours in advance of the start of the meeting to committee comments at stlewisco.com. We definitely want to hear from you. We want your participation. So please do get in touch with us. And after that, I would certainly entertain a motion to adjourn.
Madam Chair, thank you
Yes.
for your leadership, and I move for adjournment.
Second, anyone?
Second.
This meeting is officially adjourned. Thank you all.
Thank you.
Thank you.